All right. Hey guys, I'm Dr. Bill Rankis with Movement First Physical Therapy, and I am excited to welcome you all to a series of interviews that I'm going to be doing that is highlighting some of Raleigh's great clinicians in providing you health and wellness. Tonight, I have Amanda from Clarity Psychology and Wellness. She is a psychologist, and she specializes in improving sleep, depression, anxiety, eating disorders, and mindfulness, among other things. She has all the conversations that we've had have been wonderful, and it seems like she takes really good care of her clients. So I wanted her and her business to get some spotlight, so that anybody who may need to use her services can have them. So Amanda, welcome. Thank you for joining me for the interview, and I'd love to kind of just give you the mic and have you introduce yourself a little bit more, a little bit about yourself, your business, and kind of what got you into the field of psychology.
Absolutely. Thank you so much for doing this. This is great. So I am a clinical psychologist and am located in North Raleigh. So I have a practice there with an associate. And like you mentioned, we treat all sorts of things, including just anyone who wants to come in and get support and enhance their life or, create a more meaningful, fulfilling life. So not just diagnosis based, but we work with all sorts of people. So yes, my background is in sleep and depression and anxiety. So I work with a lot of people who experience those things or who have a trauma history and may also experience those things. So yes, Clarity Psychological Wellness is my practice.
Wonderful. What got you into the field of psychology? What drew you to helping people in that way? And what has you feeling like that is your true passion and how you're able to help people?
Yeah, it's interesting. It's such a great question. It goes way back for me. I was originally quite a book nerd. I still am, honestly. And at a very young age, just read and was so fascinated by people's stories. I loved just learning about, people's lives and what makes them tick. And I became so curious about human behavior and the psyche. And that, kind of I grew up, developed more and more interest in that, with early psychology classes. And through college, I actually wanted to be a psychiatrist before I learned that really psychiatrists do a lot more prescribing medication rather than psychotherapy. And so quickly realized that what I wanted to do was form relationships with people and talk with them and learn about them and help them learn about themselves.
Wow, that's amazing. That's wonderful. That's a wonderful story. Um, it's awesome that you enjoy hearing their stories. That brings to mind sometimes people are not always willing to open up. So, how have you found? How have you grown in your ability to kind of ask questions and get to the bottom of issues some people are having, or just to get them to open up?
Yeah, that's a great question. And I think that what I expect early on in my work with people is that they may not feel comfortable doing that. The relationship that I'm forming with people is across time. And so, as we work together, we build trust. And in building trust, I think that people do become more comfortable, right? Especially after they sort of meet me and see that I'm a big dork and, am sort of just another person. And as we meet week to week, I think that I find that people do open up and feel more comfortable. And I'm a pretty non-judgmental person. And so I think people just across time start to like drop a little something here and how does she react? And you can see that, I my job is not at all to judge someone's life or behavior or desires.
Yeah. Wow, that's amazing. Um, Clinical or non-clinical, you may not, but is there a question that you find yourself consistently asking, or a question that you kind of love to ask people to find out about the specific issue or the specific thing? Do you have any question like that that off the top of your head that's like, oh yeah, I love asking this question, even if it's like
Yeah.
at a party or something?
Yeah, I do. I ask a lot, especially in the beginning, but certainly throughout work with someone. I ask called the magic wand question. So if you had a magic wand and you could design, the life that would be the most fulfilling, most meaningful to you, what would that look like? What would you change about your
Mhm.
life now? And it's a hard question for a lot of
For
people, but
sure.
it really does tap into, what they value most in the world in their life.
Absolutely, absolutely. And that, I mean, it helps you get an insight of what someone is desiring or wanting to achieve, and um, helps you kind of get a little bit out of the dark in that sense. I ask a similar question um, to people, and finding out what, if I were to see you in a grocery store in 2 years from now, what would you, and you say, working with you is the best thing. What would you say? Why would you be saying that to me? Just so that I can get an insight of, okay, this is what somebody wants to do. This is what they want to be able to achieve. And so that, I can help them best. And I'm sure that's kind of why you asked that question as well.
Yeah, exactly. Because, for me, what that, uh, you know, my work with someone is not to help them create the life that would be most meaningful to me, right? This is all about what's most meaningful to them.
Yeah.
And it's not on me to make that define success for somebody. It has to come from within them. So that's one of the reasons that I really love that question.
That's awesome. Yeah, that's a I like to hear that you asked that. That is a great way to kind of get a good idea of what people are looking for. Um,
Yeah.
when it comes to patient care, um, you know, as a clinician, you have your good days and bad days. What are some things, or your top three things that you feel um, are your favorite things about taking care of your patients and helping them through their issues?
I love that question. So I would say one of them would be the relationship that I get to form with people. I have people that I have worked with for years, that I see them weekly. It's real. It's the real deal. These are people that I know a lot about their lives. I'm invested in them. I'm invested in their success as they define success. And it's a real relationship, and that it means a lot to me. So that's one thing. I would say another thing is that I I get the pleasure and honor of bearing witness to, incredible strength and resilience in the work that I do. So I have seen people overcome all sorts of things that just it's amazing. It's
Yeah.
incredible. So I feel like that's a real privilege, that I get to see that, and I love that part of my job. And then I would say, you said three things. I would say, it's the work that I do feels very real and meaningful to me. So it taps into my own personal values, in a world where we are not necessarily faced with, a whole lot of authenticity. I get to do work where it is wholly authentic. And so I love that I get to do that.
Yeah, that's wonderful. And it taps a little into kind of your why, which I'd love to get into a little bit later.
Hmm.
Um,
Hmm.
you mentioned strength and resilience of people, and that sparked kind of another thought of something I recently learned about asking people, and helping them feel a little bit empowered, but asking them, what is something that you have overcome before, and just finding out, you know what have you overcome in your life, whether it's physically, mentally, spiritually, whatever, finding out what is it something that someone has struggled with and then come out on top with. And I think that's really important and empowering to people. Another thing I heard, I couldn't tell you where, is you are the only person strong enough to be in your shoes right now, type of thing. So you have been through all the things that you've been through, and you are strong enough to be in those shoes. And I just found that a really powerful statement. So I don't know if you've heard of those things before, but just kind of came to mind when you said that.
Yeah, I like those a lot. I've often kind of asked that question about what have you overcome before. We dismiss quickly all that we've overcome, I think, or
You're
I
right.
hear a lot of people dismissing that, right? To undervalue, like, oh, well, that wasn't that big of a deal, or but it is. I mean, everybody has overcome something.
Why do you think we dismiss it?
Well, a number of different reasons that come to mind. I mean, certainly there's just a bias against ourselves that a lot of us have, where we undervalue certain strengths of ours and overvalue strengths of others. So that's one reason. But we really are taught from a pretty young age that one of the ways to motivate ourselves is to be self-critical.
Hmm.
And in fact, we find that that isn't the most motivating thing, that criticism can be quite punishing, actually, and not so motivating.
Can make a people
But
breathe.
that really it can affect us, and then has us undervalue our own strength.
Hmm. Wow. That's, thank you. Very insightful. Um, so tell me a little bit about, we're going to kind of go back to kind of you and your business and your field, but tell me a little bit about what makes you um, different, I want to say, or makes you special when it comes to your field and how you treat people.
There are a whole lot of different types of therapists that are out there, right? That just when you take psychotherapy, there are social workers, there are marriage and family counselors, there are psychologists, psychiatrists. It's overwhelming. And I am a psychologist. And one of the things that psychologists have a lot of training in is in assessment. So really fully understanding the complexity of humans, right? The mind is an incredibly complex thing. So I think that that's something that is different about psychologists in general. Something that I think is really unique for me is that I have been incredibly lucky in the training that I've had. So my training was split between University of Tennessee and Duke, and I had it was very unique in that they were different theoretical orientations at each place, which allowed me to get a depth and breadth of training that I think has really served me well. Both of them, the common thread being with honoring and understanding the complexity of human beings.
Hmm. Wonderful. Um, how explain a little bit more about um, your perception of the depth of the human being and the mind, and how you may look at not look at someone, but help someone, or look at patterns that someone presents to you with, uh, as you kind of assess and make your decisions based off of, so that you can provide them with the best help you can.
I think that it's a hard question to answer because I'm often doing that across many months, right? That I am not meeting someone once, twice, even three times and thinking that I have a full understanding of who they are and what they've dealt with and how they've come to be who they are. But that, in short, what I'm doing is thinking about not just someone's, thoughts, their thinking patterns, their emotions, and how they feel in a just sort of two-dimensional way, but I'm thinking about how they relate to their thoughts, even, or the relationship that they have with the feelings that arise for them, as well as how their histories, their complex histories, have led them to view themselves that way, or view those thoughts and emotions in a specific way. And that, you know, because our histories are long and rich, that there's a lot there, right? So
Yeah.
that to say that, oh, well, it's simply that, you know, oh, my mom was, you know, mean to me
Right.
or something.
Right. Right.
It's like, it's so oversimplified, but that, you know, there are 1,000 different ways in which one particular experience can affect different
Sure.
people.
Yeah.
So yeah, I guess that's the short, simplified version, the oversimplified version.
No, that was good. It a little bit of what I grasped from it is that, we have to be mindful of not only the situations we've been in and the way we react, but um, also how we react to certain feelings or stimuluses. That's kind of what I
Yeah,
grasped a little bit from that. I know you said a lot more, but that's kind of what popped out to me, and that's something that also I think we also have to kind of start to even acknowledge that in the first place before you can begin to make any sort of progress, which is, I'm sure, challenging on your side.
yeah, for sure we do. You know, it's not just that I feel sad, but it's how I relate to sadness and what I think about the fact that I feel sad.
Right.
Because this can get really layered, right?
Right.
The way we relate to negative emotions, for example, we're taught that, you know, being happy is the way to be. That's
Right.
what's normal and healthy, and that's just not true of
Right.
emotional experiences. So
Very nice. Um, so I want to get into, I see so much benefit to people um maintaining, improving, being aware of their mental health. But I feel like there's such a stigma in our society that people view it as almost this taboo thing that, if you have a mental illness or you're depressed or you're anxious or anything, it's kind of a negative thing. Um, Rather than going to see someone to help improve themselves and help their mental ability or their mental performance, um, they kind of avoid it. And it makes me think of, if someone injures their hip, they go see a doctor, and that's not thought of at all. It's like, oh yeah, my hip's been hurting me. I've been struggling walking. Oh yeah, you went to the doctor. Oh great, yeah. But if someone were to say, yeah, I've been really struggling mentally and I've been having trouble with this, and this, and people would kind of be like, "Whoa, shy away." And why do you think there's such a stigma, and why do you feel like people may be afraid to seek that help or be aware that there is the help?
yeah, there's a long history of there being stigma and many different things that have contributed to that. You know, that it's a shameful thing, to ask for help. I think that it is associated in many people's minds with weakness rather than strength. And I think that it is a strength to be able to be vulnerable, to ask for help, to recognize, to say, hey, this is something that, you know, I think could be better if I had somebody there with me, helping me understand myself, or coaching me along the way, encouraging me as I better understand this, or as I tackle this you know, concern. And that for a long time it's just been associated with weakness. And
Hmm.
so it's something that is one of the saddest components of this work for me, is that I still hear a lot of people either just whispering about, you know, therapy, or just a particular challenge that they're having psychologically. And I hope we're getting away from that. I have a lot of hope that we are. I actually see a lot of younger people sort of putting it out there into the world, like, yeah, my therapist said this, and, you know, even, you know, boasting about it a little bit. So I hope that we're moving away from that slowly but surely, but there's still a long way to go.
Yeah, I hope so too. I think that, I think it can help a lot in our society. I think there's a lack of just awareness of it all, and I think if we even just became aware of it, I think it would help a lot. Let alone get help for it. Um, I think we kind of, unfortunately, our society kind of goes through these phases of just distracting ourselves from these issues, and the first step is, like I said, awareness, and then being able to, like you said, be strong enough to be able to ask for help and know you're not at the best you could be, or maybe that's not the best word, but yeah, that's wonderful. We had talked about, in our previous conversations, a little bit about guidance, and so I really enjoyed hearing you say that you're not someone that, you said it before, you're not trying to make them your perfect person, and you're working towards their goals, and you're there to help guide them and not um, you know push them in a certain direction, or you help them along, which I like to hear. And then you also mentioned vulnerability, and we also talked about that a little bit, about um, how we both had an affinity for Brene Brown, and how she talks about vulnerability, and how it's important to not only be vulnerable to escape some of the sadness and whatnot, but also to be able to find joy. um, and so I love that topic. um, Tell me a little bit more about kind of the therapy that you do for sleep, as I don't think
Mhm.
that I didn't know much that it existed, and so I would love to kind of have a background on it and see if we could help some other people learn about it, and if it's something, hey, I'm having trouble with that they might consider, trying to get some relief for it.
Yeah, absolutely. So many of us are struggling with sleep.
Yeah.
And I say us because I became interested in this because I myself am an insomniac and have a long history with insomnia. And I tell my patients that I'm working with, like, hey, this is my experience, and I'm drawing from personal experience as well as from all of the literature and research that's there. So this idea of a behavioral treatment for insomnia is still somewhat new, or at least to the masses. It's a
Mhm.
pretty new idea, but actually, it is recommended as the first line of treatment for insomnia now, above and beyond medications, which is what most people reach for first, or most of what they think about first,
Right.
anyways.
Let me go get some NyQuil, or ZQuil, it's called, right?
Yeah, exactly. And so the thing that I always want to communicate to everyone is that there is another option. And people think that the other option is, if it's behavioral, it's sleep hygiene. It's
Hmm.
not. That certainly is a tiny component of what I talk to people about, but it's more about regulating our sleep, the systems that impact our sleep, our circadian rhythm, and something called our sleep pressure. Having those two things line up, and we actually can, through when we schedule you to go to bed and wake up and what to do if you can't sleep, we can have those two systems working together. Where for those who have insomnia, there are lots of different reasons why that insomnia might be there, but those systems tend to be not working together. So we can kind of improve the relationship that someone has with their sleep, how they think about their sleep, how they behave when they can't sleep, as well as actually shift their circadian rhythm a little bit to be more in line with their sleep pressure. So it's a confusing kind of process to describe without going into a whole lot of
Sure, yeah.
detail that might put a few people to sleep, but that it's
Well, that's what they need,
super.
right?
Yeah, that's exactly right. It works just like that.
Let
But
me describe it to you.
yeah, exactly. So we talk about in the first couple sessions with people, like, this is really a few different things that come together to work together. It's not any one thing that makes it work, in other words. So I tell people that it's a really, really cool treatment, and it's hard, but the good news is that it's pretty short and it works really well.
That's awesome. That's wonderful. That's it's when you said it, when you're talking about it and how you kind of break it down into so many different pieces, it just makes me think about how, like you said, people do reach for some pharmaceuticals, um, and how that's just like, you're basically putting a band-aid on a laceration or something, you know what I mean? So you have all these issues that need to be addressed and put in a line, and things to discuss and overcome. And then if you just put a band-aid on it, it may make you sleep, but do you think it creates other problems?
Depending on, because there's all different types of medications that are used for insomnia, but that one of the bigger ones is that we don't really have any medications that work very well. On average, I think one of the most popular adds about 20 minutes to our sleep.
Wow.
Research shows. And that, not only that, but it doesn't really create healthy sleep architecture. There are different types of sleep that we're getting in the night, and it's very important that we get them all.
Right.
But that no medication really creates that for us at this point anyway.
Yeah. Now I know, being a therapist myself, you can't put specifics on things because everybody is different and every situation is different. But when it comes to your therapy for people with insomnia, how soon before you see some change? I'm not saying like they're perfect and they can sleep through the night, but how soon before you start to experience some change? Because I think the reason people reach for pharmaceuticals, whether it's a sleep aid or whether it's a pain medication, in my side of things, it's because they, 20 minutes, okay, I'm set. I'm gonna be sleeping, or I'm gonna feel less pain. But when someone says, "Hey, I have this therapy that we can help you get rid of this issue," and you're like, well, how long is it going to take? What's that involved? And so that uncertainty kind of has people balk at it. Um, how long would you say before you see any sort of change?
Yeah, it's a fair question. It is a hard question to answer because everybody's different, but the entirety of the treatment is really designed to be somewhere around 8 to 10 appointments. So very short term in psychology, right?
Mhm.
Usually we think about things taking much longer. But then I would say I have many, many people who come back within 2 to 3 weeks, just with their minds blown, feeling like, I can't believe that, this idea that you had, because it sounds pretty counterintuitive when you lay it out there for them, that it works, it helps. You see a difference pretty quickly, actually.
Wow, that's very cool. That's very cool. That's good to know.
Yeah.
Because I know if you already have me wanting to tell people who say, "Oh yeah, I've not been sleeping," I want to say, go talk to Amanda. I wouldn't have any clue as to what it entails, and you've already given me some insight, and so I can't wait to help people that way.
Yeah,
Um,
awesome.
um, so let's see. What is something a little bit? This is kind of tailing on some of the stigma that we talked about. What is something that you might change when it comes to your field of psychology?
Well, certainly stigma is one of the main things that really is a challenge to a lot of the work that we do, because we want to get so much information out there, and people tend to kind of shut it out because of stigma. I
Mhm.
would also say that one of the most frustrating things, one of the most, one of the things that makes me the most sad is just the access issues that we have with mental health, because it's a bit undervalued. Um, you know, Unfortunately, not everyone has access to, has coverage for, a lot of therapists cannot, you know, afford to keep their doors open and take insurance, or afford to, keep their rate as low as they would like to be able to give everyone access to the kind of care that they deserve.
Absolutely. Yeah, that's a pretty strong message with me, is being able to provide the care that you can. And and some of the things that limit us when it comes to that. So yeah, I definitely mirror your frustration with that. Um, what what would you say that we're going to talk about you a little bit? What would you say that your strongest characteristics are in life or in business? You can kind of have different ones if you want.
Yeah, that's a good question. Strongest characteristics. I mean, I think about one of the things that has served me really well, both in life, certainly in my training and in business, would be just I tend to be pretty tenacious in the sense that I will stick with something and sort of, push through, persevere. I'm patient when it comes to, being consistent and like, okay, I'll keep showing up, I'll keep being here, I'll keep pushing through. So that's something for me that has, I wouldn't have even said that about myself probably a few years ago, but I think has come to light recently as I can see, that's something that's a strength of mine, or I like to think is a strength of mine.
That's a very good strength to have, especially in business for sure.
Yeah.
In life as well, because that's how you form and keep relationships, and form and keep habits and passions and hobbies, and so that's great to hear. What would you say is what is one of the things that you feel like personally limits you from your ability to help people, and then what is something that personally really helps you help people?
I think that, I try to show up. I mean, it's something that I think helps me. Maybe in some ways limits me as well. I'm not sure, but that certainly I work really hard to show up fully as myself. So I am authentically me. I am honest. I am pretty straightforward. And I would say that it helps. It helps with connecting.
Hmm.
That I'm not just some kind of like I'm not saying what sounds like the right thing to say. I'm really showing up as myself. I'm just a person, and yes, I have training, but I'm just another human being in the room with someone. So I think that ability and willingness to show up authentically is something that really helps. On the flip side, like I said, maybe it hurts because I am honest and I am flawed, and so showing up and being straightforward with someone, sometimes people don't
Aren't
like
ready for it.
that,
Yeah.
sometimes they love it. So it's one of those things that I don't know another way to be, because I think that the only thing worse than maybe having someone feel like I'm not the right therapist for them is showing up and trying to put on a persona of who I'm not. So I try to just be very real, very open and honest about who I am and how I am in the room with people.
Yeah, that's great. Well, I think that's important, and I can totally understand how it can go both ways. So that's a good answer. What is something that you do to keep your mind or body healthy? And what are some things that, another question, I'll just leave it at that. What are some things that you do to keep your mind and body healthy?
Yeah, a couple things come to mind. I would say one thing is that I meditate every day. That's something I'm big on. So I do mindfulness meditation. I actually teach mindfulness meditation classes as well.
How long do you
Um,
meditate?
how long?
Hmm.
Depends. I would love to tell you that it's 30 minutes every day, but I already told you that I show up and am totally honest and real, and the truth is just that I don't. So it ranges anywhere from 10 to 25 minutes right now, and it changes. So when I go away on retreat twice a year, when we're not in the middle of a pandemic, and after that, I am usually pretty good about every day, 30 minutes, 40 minutes, that
Wow,
sort of thing. But
it's incredible.
then it goes away. Life gets busy, and
Sure.
I'm not so great about it. But it's something that's really important to me, and I notice a huge difference when I'm doing that. So
Yeah,
that's one thing.
that's
Um,
amazing.
yeah, and I move a lot, so I try to move my body, and that does not have to mean working out for me. It could be a walk, yoga, could be, anything, but I try to make sure that I'm moving my body every day because I sit for a living. So I've got
Yeah,
to make sure that that's a priority.
for sure, absolutely. And I like to hear that. Good for you.
Yeah, thanks.
What do you feel like you're doing or what are you doing to help improve um, health and wellness in our community? So in the Raleigh community.
Yeah, I think that's such a good question. Community is something that's really important to me, and so I would like to be doing even more. I'll start by saying that, but I do.
That's why I
I
asked the
have
question.
what was that?
That's why I asked the question.
Yeah, I always want to be doing more because it is a value of mine. So yeah, I do have an Instagram account where I put a lot of free content out there, just educational information about psychological well-being, and then I hold trainings. So I do teach like I said, a meditation class. I have done several free trainings just in the area whenever I get the opportunity on sleep or anxiety or anything like that. So I love doing stuff like that. I enjoy teaching actually, and would love to do more of it.
Well, it's great. I think the community is a huge aspect to not only mental health, but um, also just helping people make sure that we can all, as a tribe, kind of be healthy, fit, active, well. Um, and yeah, I definitely could do more and want to do more in the future. And that's part of why I asked the question, is just to get people to think, oh, what am I doing, and what could I do more to establish even a community. Not only provide to the community, but to establish a community and bring people that may not have been thinking about health and wellness before, and get them to start thinking that. So thank you for your answers.
Yeah.
Um, what are three things that you're really passionate about in life besides family, friends, and your career?
Mm, yes. So I'm gonna call my dogs family. So I'm not gonna say my dogs, but that would be an answer. But they are my family, so I won't say them. But I would say a couple of the things that I just love, and it sounds maybe I don't know, maybe some people would feel like it's not something to be passionate about, but I love delicious food. So I love going to, like, we're in such an amazing area here with just great
Yeah,
restaurants, and
you're right.
when I can go, I love to go out and try new things and go to different restaurants.
Hmm.
So I love doing that. I also read a whole bunch. Like I said, I was a book nerd and I still am. So that's something that, for me just brings me a ton of joy. And then I love to travel. Again, when I can, I love to go to new places, be in a new culture even, or, get to just have new experiences like that. So those are things that I love doing. Those are my kind of favorites.
Yeah, very cool. Those are awesome. Um, that brings me to another question. You mentioned it twice now that you enjoy reading. What are three books that you enjoy recommending or gifting to people?
Yeah, there are so many that this is probably the hardest question for me. But I would say that, the books that I find myself recommending the most recently, one is called The Happiness Trap. So it is the kind of based on the theoretical orientation that I use most often in my work, acceptance and commitment therapy. But it doesn't quite read like a textbook or too self-helpy. It's a
Or else
great book,
it'll,
and
help your insomnia patients.
yeah. So the happiness trap really applies to almost anyone. It actually won't help the insomnia because of, like you said, it's too interesting.
Yeah.
It's too good, but it certainly, in the sense that it applies, right? Like that you will be able to take that information and apply it if you have insomnia, if you feel like you have anxiety, if you're just feeling generally kind of blah even. So it's an awesome book, and I love recommending that one. And then there's another one called The Body Keeps the Score. It's probably recommended more than maybe any other psychology book, frankly. So it's a really great book on trauma and what happens to us in our bodies, and when we experience traumatic experiences. So
I just
that's
read that
one.
book recently, actually. I
Did
just
you?
heard, someone else just mentioned that book, so that's interesting that you said that. Actually, it might have been Brene Brown, actually. So
Could be, because
yeah.
it's, again, probably the most recommended
Mhm.
psych book. Certainly it's the one I hear recommended the most
Mhm.
often. And then there's a great book that's not really a psych book in the sense of being a textbook. It's more of a story, but it is about a therapist. So it's gained a lot of popularity in the last year. It's called Maybe You Should Talk to Someone. And it was on the bestseller list, all the bestseller lists. They're a great book for just, I think, coming up against this stigma thing that we're talking about. So such a good book.
Thank you for sharing that. I promised a friend that I would ask about this. It's going way back to our discussion about sleep. And we've also mentioned that during this recording, we are under the COVID pandemic, and many people are having issues with sleeping. And one of the issue that I told I'd ask about is about dreams. But I would love if you have any advice for people to help that you'd be willing to give them that would help their sleep during this kind of crazy time, one. And then two, if there's any way you could explain why people may be having increasingly vivid dreams during this time. I'd be interested, and I think some other people would be interested in as well.
Yeah. Well, I think that one of the things I can say about sleep, especially the dreaming aspect of sleep, is that, information is, it's coming out all the time. We don't fully understand a lot of the components of our sleep. So dreaming is one where certainly we believe one of the primary functions of dreaming is emotional processing. And there's a lot to process right now. For example, there's some research out there that suggests that after a traumatic event, that individuals who dream about the event a year later are healthier than those who haven't dreamed about the event, right? Because they've done more work with their emotional processing. So that is, I think, how I'm conceptualizing why all of us are having more dreams, or remembering more of our dreams, or having more vivid dreams. So that's one thing I'll say.
Yeah,
And then what was that?
that was great. That's very interesting.
Yeah, dreaming is something that's really fascinating. And the themes that come up are often very important, right? So the other thing you asked about, kind of, tips for how to improve sleep. It really, the number one tip that I always give people is to get up at the same time every day. Even less so than what time we go to bed. Our wake up time, getting up and getting moving, getting our day started with regularity, is probably going to have the greatest impact overall on our sleep. So, there are a couple other things that I think of, like staying in bed when you can't sleep, or being in bed for other reasons than sleeping. Like, I'll just get on my email and do a couple of quick work emails in bed. Things like that tend to interfere with our sleep pretty, profoundly too. But I would say that probably getting up at the same time every day is going to be the biggest thing.
Yeah, that's awesome. That's something that I don't think. Yeah, that's really good. Thank you. That'll help, I think. Wonderful.
Yeah.
Is there anything else about your field or your practice that you'd like people to know about?
Yeah, I think the biggest thing, which I I've already mentioned is, wanting to get the message out there that there are 1,000 different reasons to reach out to a therapist. Most therapy providers will do some kind of consultation to talk with you first. I certainly do. But that, it doesn't have to be because you're suffering and depressed. It can just be that you need support, that you're struggling and not sure why, that, you feel like something's missing or feel blah, that all of those things could be reasons, wonderful reasons to reach out.
Thank you. That was nice. Thank you so much for taking the time to talk to me and letting me ask you all these questions and giving these wonderful answers. What is the best way for people to reach out to you or connect with you if they enjoyed what you had to say and would like to ask any questions or even potentially seek counsel?
Yeah, absolutely. So probably the two best ways to reach me. One is on my website. All of my contact information is there, and that's claritypsychologync.com. So that is a great way to find all the information about me and how to reach me. Another one is through my Instagram account, which is at Raleigh Psychwell. So PSYCHWELL. So that I post content on, I answer messages there, questions, anything that comes up as well.
Awesome. Wonderful. And I'll post those, I'll post the links for those for everybody. And is there anything else that I missed, or do you have any questions for me before we sign off?
I think that this was just a great idea, and I'm so glad that you're doing it, and I appreciate you having me on. I know from our conversations in the past, we both sort of share this passion for helping people, find their most fulfilling and meaningful life. And we kind of have different ways of doing that, you physically and me psychologically, but I think we share that. And so I really, really have enjoyed talking with you.
Well, thank you. The same. So it was wonderful. And again, thank you so much for now. I can't wait to share this with everybody. And I hope everybody has a great evening.
Thanks.
Yeah.